Hey guys, Dr. Justin Marcagiani here with Chemaine Linnie. Today we're going to be talking all about weight loss, hormones. We're going to be talking about perimenopause, and we're going to be talking about Chemaine's journey where she's lost what started at 280 to
Mhm.
probably over 150 pounds since that
100
point.
165.
165-pound weight loss. So we're going to be connecting the dots on her journey, hormones, low thyroid issues, gut issues. So we're going to be diving into it. We'll be talking about it from a root cause functional medicine perspective. We'll also give a mindset perspective because when you start from such a high point, it takes tenacity and grit to see it through. So I like that you have that experience, Chemaine, and being a healthcare provider yourself. It's great because if anyone has these struggles, you're a great person to reach out to. And we're going to put your link down below to Chemaine'sModelHealth.com. There'll be a link down below in the description if anyone wants to reach out and follow you on your socials. Welcome to the podcast. How you doing?
Thank you, Dr. J. It's a pleasure. I'm pretty well this morning for a Monday
Good.
morning.
Yeah, that's great. Well, tell me about your journey. Let's start from the very beginning, right? You kind of told me a little bit in the pre-interview while we're getting our mics all synced up. Why don't we just start there from the listeners? I think it's interesting to get your starting point and then how you got to where you got, and then what motivated you. What was that like thing that was like, this is not okay. I need to make a change.
Oh, man, my story is insane. I'll start off saying I am Irish. I'm from Dublin, so I'm living
Mm,
outside Calgary now. I've been here 11 years, so
wow.
people will hear I say estrogen and a few things a little
Oh
bit
yeah, yeah. That's cool. That's
on
nice.
the accent or I say iron as well. So,
Love it.
but my story, like I started my journey in 2006.
Hmm.
And it was with the help of my sister. And I think it's important to understand where I was at that stage. I was a teenage mom, so I had just had a baby and I was at my highest weight, but I didn't know I was at my highest weight because back
Wow.
then we didn't weigh ourselves. We didn't kind of have much education around it.
Right.
But I was miserable. I was being bullied. I was
Mm.
binge eating. I was crying. I was being bullied by family members. Like everyone was saying horrible things. And then I have a baby as a teenager, and that made things worse. Now I had ruined my life. I was a loser. I was never going to amount to anything.
Mm.
And it was just all doom and gloom everywhere. And luckily, I had a sister who loved me so much. She wanted to help me. So she convinced me a little trickery. She said she was going to Weight Watchers with her friend next
Mm.
week, and would I like to come along? Little did I know that they had planned to get me there. And I
Really?
remember I was so unhappy, Dr. J. I was just crying all the time, eating. I was eating away my emotions. I would
Mhm.
sit and I would pull at myself and my weight and my stomach, and I didn't know what to do because you don't know what you don't know. Put it like that. And I was so young. I was living in baggy sweatshirts. I was wearing my brother's clothes. I couldn't get close to, and just to put this into context, I'm only 5'5", so I'm not tall. I didn't carry it very well. I
Right.
looked very big. Um, so we went to Weight Watchers, and long story short, it was the first time I'd ever truly weighed. And the Weight Watchers leader at the time, lovely woman called Mary, told me I was 280 pounds. And I remember sitting there with everyone just trying to comprehend at such a young age, like, what just happened? What does this mean? How did I get to be so big? And I remember going home that night
Mm.
and I cried in bed. And I cried and I prayed to God and I said, give me the strength to do this. I will never go back to this weight ever, ever again. I was so unhappy. I was like, I have a new baby now. I can't live like this. And I decided, like, that, I really believe a lot of people need to hit rock bottom to build themselves up. And I was at rock bottom. I really was, from crying and emotional eating and hating leaving the house to trying to have a new baby at such a young age. Luckily, I had a supportive family, but I was miserable. Like, I ask my people now, at what point are you so miserable that there
Right.
is no going back? And I wonder how many people really hit that. So then I transitioned and I started losing the weight, and I would go, and every time the baby would nap, I would do some sort of dance aerobics just to get
Right.
into it. And then I would start walking, and the weight started coming off. So that first week, I'll never forget, I went back to Weight Watchers and I lost the 8 pounds. And everyone loses a lot in the first week. But that was enough to put fuel on the fire and keep me going. And then it started to snowball. I was mentioning, then I decided I actually have a knack for health and fitness. So I transitioned into first it was dance aerobics and step aerobics, and then I got into the University of Limerick and I got my degree in personal training. And
Hmm.
then I got into Pilates. I found a wonderful Pilates master in Dublin, so she kind of took me under her wing. And even when I got pregnant on my second child a couple of years later, well, it was about 10 years later, you're not supposed to allow people to do courses or train when they're pregnant, but
Right.
she was there and she kind of held my hand and made some exceptions. So she was great. So then it's snowballed. Um,
And so I'm just curious. So, no, you're in the functional medicine field now, nutrition, functional nutrition. Tell me about Weight Watchers. So you had some success with it. What's your take on Weight Watchers now, looking back? And
you
why do
know,
you think it helped you? Because I mean, I'll give you kind of my take on it. I'll give the general listeners, but I want to hear your take. It did help you. So go back to your take back then and kind of how has it evolved?
Hmm. So looking back on it now, I obviously look at it very different and I can
Hmm.
understand, okay, they created a calorie deficit and it was quite a big calorie deficit. And considering the weight I was, of course I was going to see results. Back then, we had a point system. It
Yep.
was back in the early 2000s. So
Yep.
it was a point system, and there wasn't much emphasis on like the nutrition aspect. There was a lot of
Correct.
emphasis on the hydration, make sure you get your water. And it was funny. It was anytime someone would plateau, they would say, drink more water. And the next week, someone would come back and they'd lose their weight. And it was almost like, oh my God, this is magic. Just drinking water helped me lose weight. It was quite entertaining. They're very good. One thing that Weight Watchers does very, very well is the community. They
Hmm.
support each other very well and they have a lot of accountability. And I've tried to replicate that over the years in my groups. They
Yep.
would always give you a high five, or you got like these, they'd have these little stones or crystals that if you hit a certain benchmark,
Yeah.
you would be awarded like a diamond. So for every
Yeah.
50 pounds, and you'd also get a certificate. So there was a lot of that feel good encouragement to keep
Accountability, celebrating
going on.
milestones, kind of like you see with different, Alcoholics Anonymous, they give you coins or tokens, things like
Mhm.
that. Yeah. So accountability, celebrating your wins. That makes sense. I'm going to just riff for a minute. I think, like you mentioned, talking about Weight Watchers from a calorie standpoint, where essentially, and I'm not sure how it was back then, but you got your point system, right? And so the average person, like around your height or weight, is probably going to get about 25 or so points a day, right?
Mhm.
The big issue I had with Weight Watchers is there isn't a focus on the inflammation aspect of the food or the nutrient density.
Mhm.
And
Mhm.
they've done some scoring stuff where some of the foods may have a lot of artificial sweeteners, or they give 0 points to fruit, which we know sometimes if you're very
Mhm.
insulin resistant, having an ad libitum as much fruit as you want may not be a good situation. But I think where it does do well, some of the 0 point foods that are like as much as you want, non-starchy vegetables, protein sources, and eggs, it kind of makes sense, right? So they're emphasizing good protein, they're emphasizing maybe some healthier fats if you have eggs and things like that. And if you're getting non-starchy veggies. So I think it's really pushing you in that healthier, more paleo direction, so to speak.
Mhm.
I think where the shortcoming is the inflammation, the nutrient density, and potentially like the artificial sweeteners and the unlimited fruit stuff. Thoughts now?
Back then, when I was doing it back in 2006, it was more around the portion control and the
Yeah.
discipline. That was the focus. Like you could have this as long as you agreed to only have this much. And if you hold up your part of the bargain, you will see the results. I remember measuring, like if I had a sweet tooth, I could have two biscuits back in Ireland,
Yeah.
two biscuits, and that was my treat for the day, and everything was calculated. And in that aspect, it created a lot of awareness that I do I can't just eat willy-nilly. I do have to have some sort of restriction there, which stands true to today, even though a lot of people don't like to hear it. There has to be some sort of restriction or sacrifice somewhere. And back then, there was encouragement to eat, quote, whole foods, for a lack of a better word, but it wasn't the emphasis, like you said. It wasn't the nutrition aspect. It wasn't this food is highly inflammatory or reduces inflammation. um, it wasn't anything like this food will support your thyroid or food timing or anything like that. um, so it's changed now, from what I understand, that there is a little bit more emphasis around the nutritional aspect of certain foods, but not much on, um, again, this is inflammatory, this will impair detoxification. There's
Correct.
none of the granular stuff that we get into now.
Correct. And then when the portion control thing was going on, were they assigning points to the amount of food back then? I'm just curious.
It was a lot
You
of it
recall?
back then was more the nutritional label on the pack. It was a
Yeah.
lot of
So
packaged
it's
food.
evolved a lot since then, from
and
now to then.
and
Okay.
then, like we said, like green foods, green vegetables were your zero foods, and then you would have a list. So they gave
Yep.
you a little book and a little calculator, and that's how you kind of calculated everything, and then a tracking sheet, which I found to be amazing. I actually replicated it when I started my business, and I've used it ever since because it was effective for people to visually see what they're doing.
Yeah, that makes sense. And tell me about what your diet was like beforehand, because I think the more poor someone's diet is before they go into any diet, more processed food, more sugar, things like that. If they cut that out, they're going to do great no matter what they're doing. I'm just curious, what was your diet like before you started this journey?
It was I knew nothing about
Yeah.
nutrition at all, and neither did my family. And of course, as a young girl, like my mom was doing the majority of the cooking.
What did a
There was
typical breakfast or lunch or dinner look like? Just and then how about like soda pops and drinks during the day? What is that? What was that like?
that well, first breakfast was like toast,
Yep.
lots of toast and cheese or cereal.
Hmm.
Toast,
Hmm.
butter, cheese. One thing that people, my family still laugh about is I would have pizza, and I wouldn't just have the pizza, I would butter the pizza with mayonnaise,
Oh, wow.
the whole thing. And I'm like, upon reflection now, you can kind of see how I got so overweight. But
Yeah.
we would sometimes my mom would buy takeout or takeaway, as we call it in Ireland, twice a day. So the
Really?
environment
Sounds
wasn't
expensive.
encouraging. Well, back then it wasn't as much as it would be now, but the
Right.
environment wasn't encouraging. It was very, I don't want to demonize sugar because it was both. It was
Mhm.
very much the sugar and the fat combination.
Sure.
There was a lot of pizza, there was a lot of toasted or grilled cheese, as you call it. There was a lot of yogurt, but not plain yogurt, the yogurt with the granola and the sugar as well in it. It was a lot. It was a lot of food for someone so small. And it only happened, Dr. Justin, and it's
Mhm.
important to add this in, that when I did have my baby, when he was about one, my dad had built an apartment out the back garden of the property. So I had my own kitchen. And that made things easier because then I was cooking for myself and I was able to control things a lot more. And that's where that self education even came in, between the Weight Watcher stuff and what I started to learn when I was doing like my personal training degree as well. And before all of that, I had gone and I was involved a lot in biology too. So I was able to start, self teaching myself. There was no external influences in that aspect.
Yeah, that makes sense. And how much will you do? Were you doing a lot of sugary drinks at all back then?
Back in, yeah, well, not a lot in context of what other people drink, because sugary
Mhm.
things are not my vibe. Was probably mostly the pizza, because I wasn't having a slice of pizza. I was having the whole pizza.
Yeah. Okay,
The
got it. That
whole
makes sense.
But
Okay.
I would drink, like, in Ireland, we had Lucasade, we had Lilt, we had Fanta, different kind of, like,
Yeah.
pops, but I've never been a pop drinker. It's not my thing. I wanted food. I was trying to fill a hole that was damaged from past experiences. I was scalded when I was a baby and I was in hospital for 6 months and they thought I was going to die. And I've discussed this before that I believe that affected my central nervous system a lot. So I had a lot of anxiety, and then you compound being bullied as well, and then having a baby at a young age. There was a hole inside me that I was trying to fill with food. And it was a lot. Like, I always wanted to be chewing something. I would even go out during the evening by myself and go to the takeout and eat takeout in my car where nobody could see me or knew. Like, upon reflection, it was a really sad existence, and I was very, very unhappy.
When people eat, right, there is a neurotransmitter bump that you get from it, right? Dopamine, serotonin. When you bump your insulin up, it allows all these amino acids to flood across the brain and you get this therapeutic increase. And so it's really easy to use sugar and a lot of these processed foods to get that neurotransmitter bump. But the problem is, I call it like when you have nutrition, you want to eat in a way that supports you constructively, not destructively. I.e., you can get energy destructively from doing cocaine, but you can also get energy from a healthy night's sleep and eating well. One's constructive, it builds you up. One is robbing from Peter to pay Paul. It's destructive, right? And so when you use sugar like that, it's just destructively giving you that short-term bump, and then it's dropping you down in the long run. Plus, the foods are manufactured to be addictive, right? They're putting certain things in there. The fructose does not feed back to the leptin, so it's hard to really feel full. And so you're never really in control. You never get that satiation. Plus, the nutrient density isn't there either. And your brain and your energy pathways and your hormones need the nutrition. They need the building blocks to make the raw material to do all the things you need to do.
Mhm. I think, yeah, back then I obviously didn't know all of that, and as far as I knew, I was just the worst that food could do to me was make me gain weight. Like, that was the
Mhm.
worst it was doing. And I think a lot of people, even though we have a lot of knowledge and people like you and me teaching people nowadays, I think a lot of the general population still doesn't consider it how we consider it. They still just think of the superficial, the weight aspect and how it's going to affect their weight. And even then, I had a lot of aches and pains at such a young age. Even like jumping off a wall would hurt, like, which is crazy to be a teenager and hurt. And now I can, get up out of bed and not hold on to the rails, or I can get up out of the chair freely. I can walk. But as a teenager, I couldn't do that. It's
Yeah,
it's insane how, especially at such a young age, we are so ill educated, especially in
correct.
Ireland. Oh, we didn't know. Tom Bilyeu, I don't know if you know him from
Yeah,
Impact Theory. He's an amazing
yes.
speaker, but he says, like, and I 100% agree, we need to start with the children. We
Mhm.
really do need to start with the children. And we're
Correct.
getting better. But back when I was a child, we didn't get any nutrition education at all. We got the
Correct.
exercise, we had PE, you have to move your body. But that was the extent of it.
Well, and if you look at in United States, almost every single public school, the people that run the nutrition program, they're dietitians. And it doesn't take long through just going through a couple of AI websites, you can find out who funds the dietitians, right? Mars, Kellogg's, they're totally funded by processed big food, big agro, right? And they're not funded by your local grass-fed meat consumer, your local organic farm, right? So a lot of processed food behind that. And so of course the information's going to get skewed, and then they create, the lunch program. And that's a problem. That's a big issue.
Yeah.
Now, one thing talking about the calorie model, I think there's some good and bad, right? If it gets you to think about eating a reasonable amount of food, that's good. But the problem is, what if you're not satiated? What if your brain is malnourished and you're not getting the nutrients that should be coming in? Then it takes a lot of willpower to get your food that way. And also, there's two kind of ways I look at the nutrition model. Right, the calorie model is gas in the gas tank. You put it in, you burn it up. Right, you want to put just enough in so you have enough to do your thing, and then there's extra. Right, and then the difference is, instead of running on empty, your car would actually start to burn fat. Right, that's with your body. The difference is, I look at calories as the construction site model. Here's your home. You got your plot of land. You're going to build that house. You have the lumber for the framing. You have the pipes brought off for the plumbing. You have all the wiring for the electrical. Imagine if someone brought a bunch of lumber that's legitimately moldy. Pipes were rusted and the wires were frayed. You'd be like, what the heck? You're not building my house with that crappy raw material. Send it back, because the raw material has to have good quality to it, or the form that it becomes less than, right? And so I
Mhm.
look at calories as like that. You need the raw material to build you. If it's moldy, if it's frayed, if it's already rusty when you're starting off, then it's probably not going to build a good house or build you a good you or good hormones or good mitochondria or good energy pathways. Thoughts on
Mhm.
that?
Yeah. No, I see that currently in the gym, and I've spoken about this with my clients many times. It Even if you see someone, you'll see the same person go to the gym, and 3 years later, you'll see that same person there, but their body composition and their physique looks almost the same. They don't have the quote gains as we would expect them to have. And it usually comes down to the nutrition aspect. You might be in the gym every day working your butt off, but you're not seeing the results
Hmm.
because your nutrition when you go home is not on point.
Hmm.
Um, and I know it is challenging for people. And I know there's so much talk out there now. We started with you are what you eat, and then it
Correct.
became you
Mhm.
are what you eat, ate,
Eat,
and
right, right.
then it became you are what you eat, ate, and digested. And it just
Yep,
kept going on. And
yep,
I think we
yep.
kind of overcomplicate it a little bit if
Hmm.
we just say, like, you are a reflection of what you eat. The
Yep,
end, full stop. We don't need to overcomplicate it. If you're not getting the results that you think you
sure.
should be getting, you have to look at your nutrition.
100%. Now, tell me about when you started looking at the hormonal element. Because we talked about, and again, at the time when this started, you were late teenager, early 20s. So I'm guessing perimenopause wasn't a thing for a decade or two later. Tell me when that came about. Tell me when thyroid issues and gut health became, like, just kind of walk me through that timeline of when those became the next barrier to look at and address.
Okay, so I lost 165 pounds in a year and a half, which is
Wow.
very fast. And again, I was doing my personal training and I was still with Weight Watchers, hit my goal, but still didn't have a complete understanding of health. There's only so much personal training tells you about the body and how biochemistry works. And then Weight Watchers was very superficial. So I didn't understand that losing weight that fast would have an effect on me, especially postpartum. There was no education around any of that at all for me. I did know, though, Dr. J, I did know that my mom and my aunts and my grannies, they had health issues. I knew my mom had thyroid issues and I knew she had goiter. So I did know that, but I didn't know what it meant until years down the line, and I transitioned into nutritional therapy and more into kind of, well, I was in biohacking for a while, whatever that
Hmm.
means
Yep.
nowadays.
Hmm.
Over the years, it's involved, and then being mentored by Dr. Michael Platt and a lot of other great people. And you, of course, I mentioned you've played a big part in
Nice.
what I
Thank
actually
you.
know, that I didn't realize again how losing weight so fast. And I want to emphasize that because everyone wants to lose weight fast. Like 165 pounds in a year and a half is pretty insane. That's like another person I lost.
Yes.
And I
Yes.
didn't realize the damage that I did and that I already had a genetic predisposition because it ran in my family. Part of that was mental health issues. Now I don't didn't suffer with mental health issues the way other people did, but I definitely felt it. My hair would never grow past a certain length. My
Really?
skin was terrible. My skin did not bounce back very well after losing that much weight. So I have a lot, I'll say had a lot of loose skin, and I have not had any surgery done, but I've been able to tighten up my skin. I had a lot of stretch marks. Um I
How did
had
you tighten it up? Were you doing, whole body vibration, adding more collagen peptides, any things topically, laser stuff, red
so
light?
in the last, say, 6 years, I've been doing mountains of collagen peptides. I think you
Mhm,
put me onto that. I do a
mm,
lot of minerals. I do
mhm.
because I have hypothyroidism. my circulation is atrocious.
Mm.
Even with the amount of muscle and movement I do now, it's still really bad.
Do you
So
need thyroid hormone?
I take desiccated thyroid,
Okay.
which has been amazing, but I do a lot of body brushing to improve the
Mm.
circulation. One thing I actually swear by for helping my skin tighten and improve is actually polyphenols. I get a lot of polyphenols into my diet, a lot of them. That combined with the collagen, molecular hydrogen I got introduced to. I
Mm.
got a cervical cancer diagnosis back in 2020, and they offered me a hysterectomy at that stage, which was crazy. So I've been, there's a saying, and I'm sure you've heard it before, that as practitioners, our mess becomes our message. Every time I got thrown into a mess, I had to figure it out. And then I was able to spread the word and teach people. But I do think body brushing has been a big factor for me. As someone with hypothyroidism, we know that circulation and lymphatic stagnation is a thing. So I have to actively make sure I'm moving everything every single day. Like once a week is not good enough. I have to do it every day. I have to make sure I'm walking. I have to do inversion to bring blood flow back towards my heart. It is all the things, as we mentioned in our podcast conversation on mine, that it's not one thing, it's all of the things. So I recognized that between the fast weight loss, like the extreme weight loss, and my mom's hypothyroid, and then I had all the markers of hypothyroidism.
And then so give me the timeline, right? So, okay, a year and a half later, you lost a whole person, 160 plus pounds. When did the thyroid come in? And how did you start to incorporate that? Like what was the next big aha for you after starting with Weight Watchers and doing that in your early 20s?
The thyroid was always there, I think, Dr. J, from the moment I was born, and then almost triggered by when I was scalded as a baby, that traumatic event. And but I didn't know. I didn't know what I didn't know. I didn't understand about thyroid until I came to Canada. And that's when
Mm.
I started practicing in nutritional therapy and started recognizing all these, like, all of a sudden I started getting some varicose veins and some spider veins and noticing my circulation was bad. And the more I kind of got trained in the area, then I started to realize, oh, I have a thyroid issue. And then I got a diagnosis. And then I was able to take action and delve deep into what was happening. But again, just like everyone else, I didn't know what I didn't know. It was only till I got to Canada that I was exposed to more, that I was exposed to amazing practitioners like yourself, like Dr. Platt, like even Alan Christensen, we mentioned him before. I was exposed to more. And that's when I suppose the podcast started to come on the scene as well, where people were given more access to things. So then I started with iodine. I actually followed, Dr. Isabella Wentz, the thyroid pharmacist.
Yes, yes.
So between her and yourself, that was kind of my stepping stone into understanding how thyroid really worked.
Mhm.
And then I started to implement, and a lot of things didn't work. And then a lot of things did. One thing that was a game changer for me was desiccated thyroid. Desiccated thyroid and iodine were game changers for me. My hair just came back tenfold, my energy, my muscles just blew up. People forget, like when we talk about thyroid, people very much only associate it with body weight and metabolism. But thyroid makes everything work better.
Right.
Everything. And that includes how you perform in the gym, how you grow muscles, how you think, how your bowels empty, how your menstrual cycle shows up. It's
Correct.
everything. It's not just the weight.
Correct. And so when did you start natural desiccated thyroid in this journey? And then what were your thyroid numbers like? Were you very elevated TSH? Were you T3 out of the reference range? How bad were your markers? Did you
So
have a
in
lot of Hashimoto's too, TPO and thyroglobulin antibodies?
So in Canada, unless you get an amazing doctor, you're very limited to what they will test. So in the beginning, all that was tested was TSH. And
Okay.
back then, I did not know the correlation between cholesterol and ferritin. So
Hmm.
I didn't even know to
Correct.
look for them at all. So my TSH was 3.5. And back then it
Okay.
was in the range. So I had no prescription. I had no help. I was
Right.
fine. I was young. I was normal. But I knew I wasn't normal because I had
Right.
all the symptoms. And again, with the help of all these amazing mentors and practitioners, I was able to decipher, well, just because this TSH says I'm this does not mean that I'm healthy. So
Correct.
then I did go to a naturopath and I did get everything tested. My TPO looked fine, so that was comforting. And I'll clarify that whenever I get blood panel results, I don't necessarily take their word for it. I'll still go home and I'll vet the results myself and see where the ranges are. So I don't always take everything the doctors or naturopaths say as gospel.
Hmm.
But the thyroid antibodies looked okay. And I put that down to doing a lot of work on the anti inflammatory end myself. And because when I got diagnosed in 2020 with cervical cancer, the oncologist also did a full MRI on me to make sure there was nothing anywhere else. And what they discovered then was that I had diverticulosis too.
Mm.
And that I actually have my biggest pocket, like most people have in their descending colon. And that answered a lot of questions because I had this pain I couldn't get rid of in my lower abdomen, but also my low left back. The pouch was so swollen, it was pushing on the nerves in my back, and nobody could figure out why I had a pain in my back. So once I got control over all of that, a lot of my issues started to subside. And I think that's why my TPO antibodies were in a good range because I had already taken action there on it. Um, and then, so the last 10 years is really, or not 10 years, the last 2 years is where I've really taken a lot of action on everything, because the 2 years before that, when we were in the height of the pandemic, I was more focused on, I'm not letting cancer kill me. I have two young kids. I need to survive this. And I knew through other work from Tyler LeBaron and the Water Research Foundation and all, I knew I had to get inflammation down. I could heal my own body. So that was my focus. And once I kind of overcame that and I got the all clear, then it was like, okay, now how do I optimize how I am now so I can be better so that doesn't happen again? Because I know just because you overcome cancer doesn't mean that it's gone forever. It could very easily come back. In fact, I'm probably more likely to get it than someone else who has never experienced it. So the next step was to optimize that. And what was my key focus there? Well, it was going to be, one, my thyroid, but two, and this is where I kind of transitioned into early perimenopause symptoms, is if anything is going to kill me, it's going to be stress. And that's
Hmm.
where the hormones came in.
Okay. So just to kind of just round everything up. So you mentioned the diverticulitis or diverticulosis. Diverticulitis is more acute inflammation.
Mhm.
Diverticular are these little herniation pouches in the colon, and when stuff gets in there and gets stuck and creates inflammation, then when it's chronic, it becomes more of an itis to an osis. What were the foods you think you were eating back then that was creating that inflammation in your diverticuli in the colon? Because you were healthier back then, right? Were you eating a lot of nuts or seeds or something that could have
Oh,
made it
yeah.
more inflamed? What do you
So
think? What foods did you pull out that gave you the relief?
I don't eat a lot of nuts and seeds anymore at all because they mess me up a lot. Now, full disclosure, I've never had a full diverticulitis flare. It's never gotten so out of control that I've got an infection or anything. The worst
But
I
it was
will get.
chronic though. It was chronic. They wouldn't have given you the osis diagnosis, right?
Yeah, so the diverticulosis means it's there. I have it. I'm going to have it for the rest of my life. I have the pouches and they will get inflamed, but I won't get a full diverticulitis flare
Got
in the
it.
sense where I won't get full blown inflammation and a bacteria infection. That's usually where someone is so sick, they have to go on antibiotics and then they can go septic as well. The extreme end is that you would have to have some of your colon removed, which I definitely don't want. And then you could end up with a colostomy bag for the rest of your life. So again, I think because I'd already taken action trying to address the cervical cancer inflammation aspect, that I was able to keep it. The worst I'll get now is if I eat something bad, we're on vacation or something, I'll get that big pouch in my descending colon will swell, so it'll get inflamed, and then I'll feel that. It's not horrible, but I'll feel it. But I eliminated nuts and seeds for sure. I don't eat bread. I'm not a bread person, but I don't go near whole grain. If I do, it's going to be sprouted or fermented. I take a lot of enzymes. My mindset really is, the more easy something is to digest, the more hypoallergenic it is, the more pre-digested it is, the easier it's going to be on my intestines. So, and that was really the approach. So a lot of my diet is very hypoallergenic.
Good.
I did actually, not to give you all the glory, but a lot of your autoimmune protocol was
Mm,
where I kind of transitioned there as well.
mm.
So, and Dr. J, over the years, you become so accustomed to this that you know what your body will respond to and it won't. There's some key players, though, like peanuts, absolutely not. Cashews, absolutely not. Whole grains, no. I don't eat a lot of legumes or beans. If I have beans, they're like pre-soaked, pre-washed. They're baked beans. They're easy to digest. So there's a lot of consideration there around the inflammatory foods.
Yeah, the big thing I find too is just that chronic overweight, that chronic visceral adiposity increases the intra-abdominal pressure. And then you have these little haustra, which are like these, they control almost like the pouch opening. So the more that pressure is on the abdomen and the more inflammation is, the more those little pouches, diverticuli, can open up and food can get stuck in. Also, just not having good bowel motility, right? You're straining a lot to move your stool because maybe there's a lack of fiber. Maybe we're not breaking down our food as well, and it's harder to move through the intestines, and we have to bear down more to evacuate it. Chronic NSAIDs, right? That could be a big thing. And then just not having good bacterial balance, having more dysbiotic bacteria, more SIBO, not enough beneficial probiotics. And then you have some of these little in between inflammatory foods like the nuts and seeds that we may cut out on an autoimmune diet that can also be a big driving factor. And sometimes getting the digestion better and then getting the motility better while we fix everything can also be a big help. That's some of the root causes that I look at from a functional medicine practitioner
If you
side.
don't mind, I'll just add in something.
Mhm.
Diverticulosis is pretty hard to diagnose unless you're getting an MRI or a CT scan or a
Mhm.
colonoscopy. Is pretty hard. Their guesstimation is that the majority of the population has some level of diverticulosis, but they don't know about it. If you have diverticulosis, you're going to be more sensitive to dehydration. Two
Yes.
summers ago, we had a huge heat wave in Calgary. It was 45, 40 degrees for a whole week. And I remember I was still training hard because, again, you don't know what you don't know. And I thought I was hydrating sufficiently. And I remember going to the bathroom and I called my husband up and I said, I don't feel well. And I made it to the bed and I fainted. It was my first time. I
Wow.
went hyponatremic and my
Wow.
guts started
Electrolytes are low.
spasming.
Mm.
My guts were spasming so hard I couldn't move. The pain was so intense. If you've ever had an actual large intestine flare, it's so painful. And that was, again, I learned then that you are more sensitive. And one thing I also do now to support my large intestine is I do a lot of abdominal exercises. I'm sure you've seen the research that shows if someone has IBD, if you can keep the core muscles tight and strong and keep blood flow moving, it helps to keep the flares and the bloating and the whole lot under control. And I really find if I don't keep my abdominal cavity tight, that I'm more sensitive to that gastric inflammation.
Yes, 100%. I'm a big fan of just compound movements. All compound means is just multi-joint movements that are functional and that require your core in the middle to have to brace. So I like single leg step ups. I like single leg deadlift with a row. You can do a lunge movement, right? A farmer's walk, kettlebell swing, something that involves the muscles here to have to brace here so the muscles here work as well or stabilize. So that's just something that I've seen is helpful. Try to choose as much movements that allow you to feel good, get a pump, get strong, but also they carry over into the real world. Now, getting your kid into the car with that one-legged squat with a side lunge, now it's actually allowing you your day to day to get better, easier.
Mhm. Yeah, for sure. Still have to be careful when you have diverticulosis. There's certain moves I can't do because it will cause a flare. I have to be careful with the amount of weight I'm lifting or pushing, even a seated row because of the angle and the intensity put on the lower abdominal cavity. I have to make sure I'm bracing properly. This is a lot of consideration when you actually know you have it. But there are things you can do. It doesn't mean, oh no, I have this for the rest of my life. I'm going to end up with a colostomy bag. That's not true at all.
100%. Now, tell me about where this is good. So we kind of connecting the thyroid component. We're talking about the food and your kind of, evolution of food going from the calorie model to nutrient density to hormones and to inflammation. That's good. So you're making this evolution as you learn more. You started more conventional. It still worked, right? Some of those principles can still
Mhm.
help, but then
Mhm.
you just continue to evolve as a patient and then as a provider yourself. Tell me where some of the female hormones came in. What was that next step like?
So, obviously getting older, and as my
Mhm,
clients got older as well, I was aging with my clients, and I started to notice a lot of their symptoms I had too. And then I had some extra symptoms they didn't have. So
mhm.
that's where I started to notice over the last 2 years. The biggest thing was I'm not as resilient as I used to be. I can't handle all this stress the way I used to handle it. Like my cup fill it over at this stage. And I noticed with a lot of my clients as well that they weren't as resilient. And because of that, then their motivation and their food choices, and of course their sleep, everything started to change and decline. Um, Thankfully enough, the sleep has never been an issue for me. But I did notice that I'm going to say this for lack of better terminology because I think a lot of women will relate to this. I wanted to kill a lot more people than I used to. I just, my patience went
Irritability, patience. Yep.
everything. My husband's breathing, the smell in the house, the noise out,
Sure.
just everything was just too much. And I was just like, stop, just stop this.
And so, what was the next step? What labs did you assess, and what did you see? Was it a combination of low progesterone, low estrogen, low testosterone, low DHEA, or were there certain things that were okay and others not?
So I didn't do labs. I'll be completely honest.
Hmm.
I didn't do labs on my hormones. And I
Hmm.
still don't do many labs with my clients
Hmm.
because I believe the symptom picture tells more than the labs. And
Hmm.
I know you talk about a lot about labs,
Hmm.
but my experience, I think a woman knows her body better than any labs is because we see
Hmm.
it time and time again that we're being
Hmm.
told there's nothing wrong with us, everything looks normal. Oh, you just need to lose weight and exercise. But a woman's like, but my leg is hanging off. Like there's clearly something wrong with me, or my cycle is changing, or all of a sudden I'm getting two cycles. I started actually missing a couple of periods. So it was two, and I knew that's not good. I'm too young to start missing period, but also why am I so agitated all the time? Why does everything annoy me? Why am I short tempered with everyone? And now I'm missing cycles. So I was able to trace it back to the stress. And of course, through the grapevines over the years, I had heard about the pregnenolone steel.
Yep.
And then I came across Dr. Michael Platt's work on a
Hmm.
podcast. And I was like, so he was speaking about adrenaline dominance. Back to what I said
Hmm.
about my early birth, like my early life when I was scalded, like I got third-degree burns, I still have all my scars. I
How did that happen?
Because I was a toddler and tea in Ireland's a big thing, and my mom
Yeah.
had made a fresh cup of hot tea but with no milk or anything in it, just the boiling water and tea. And as a little girl, I pulled it off the table
Yeah.
and it
Oh
came down
my
here.
gosh.
So my scars are here. They've healed a
You,
lot. You
amazing.
can't really see them, but I think that then triggered the adrenaline response. So even at
Yo,
times when
yeah.
I speak on podcasts, you can hear I'm wired. Like
And
I've got
what
wired.
did you do topically right after that? Do you remember? I know you were young. Do you remember
I
what
was a baby, so I was put into the children's hospital in
what was the
Dublin.
topical routine that they used on you?
I have no idea. I know I was in the hospital for 6 months and they didn't think I was going to make it. And I had some grafting done and I
Yeah.
was on IV and everything. And luckily I did make it. And because I did, then I was the golden child because I was so close. But
So
there,
just a
I,
list, yeah. Just a friendly put out there for anyone listening, like who's in this situation, who has been. I actually met someone who had full body burn when they were very little, and they were like, I think 20 now. And I spoke to the parent at the time because they were, they were your age, and so they didn't have much recollection either. But they used, and it's actually one of the biggest oils that are used in burn victim units in the United States, is they use emu oil, and they
mm,
like were buying it by the gallons full and topically and applying on the child twice a day, and she had no scars at all.
mm,
Unbelievable. So, and then again, how does this relate? Because not everyone's getting a third-degree burn, but there's trauma from the sun and just
so,
oxidative living. So emu oil is a wonderful anti-inflammatory oil that can help your skin. And even on the acute side, sunburn or full burn, it can be very helpful as a healing oil.
so I think that's what triggered as well that higher adrenaline
Mhm,
response in me. And when I came across Dr. Platt's work, then I
mhm.
recognized everything Dr. Platt was talking about with adrenaline dominance. I had a lot of the symptoms, which also coincided with the low progesterone symptoms. So I reached out to Dr. Platt and I'm talking to him. He came on my podcast. Then he offered to mentor me. And I was like, man, I just came from this 280-pound new
Yeah.
mom. And now I have Dr. Platt offering to mentor me. So then I started progesterone and it made a huge difference to my adrenaline
How many
response.
milligrams are you doing?
I started at 50, just 50 in the
Okay, so
evening,
conservative.
and I've slowly titrated up to averaging 200, 250 in my luteal phase in the second half of my cycle. I try not to use it too much in my follicular phase because I'm still ovulating. I'm still got a regular cycle. But if I do have like an extremely stressful day in the first half of my cycle, I might put a bit on before bed just to
Okay.
try suppress that adrenaline. And that's where that spirals. So then that combined with the desiccated thyroid, game changer. They say that things get harder as you get older, but in the last 2 years, my physique and my strength is better than it's ever been. It just peaked. And of course, nutrition plays an aspect, but I do think these hormones have made a hell of a difference to everything from my skin to my energy to my ability to build muscle to my
Sure.
ability to staying out of prison and not killing everyone in sight. And I think this is what a lot of women experience is just like uh, we're told that everything gets harder as you get older, but that's not necessarily true. It might get harder in the aspect you've a lot more to do and prioritizing yourself is harder, but it doesn't mean that actually the work and the outcome is harder. It's just maybe finding the time to do it gets harder.
Correct. I find with women, especially men too, but women more because they have a cessation of their ovarian follicles, all the follicles that you have you're born with, and so when those follicles run out, you don't have that same hormonal production from them, and so you got to rely more on that DHEA. And then progesterone is really important because when you're stressed, your body will pinch hit progesterone to make cortisol, and then progesterone opens the GABA chloride channels and allows you to have that inhibitory relaxation from stress. And so if you don't have the brake in your car, that's like GABA, GABA is the brake. If you're driving a car without a brake, I mean, you're kind of screwed, right? So it's the same thing. We need that emotional brake to get the GABA to kind of bathe the neurotransmitters to say, relax, chill out. And that plays a role. What about neurotransmitters? Did you ever play around with amino acids and nutrient support for the brain?
I did with Dr. Isabella Wentz when I first
Mm,
discovered thyroid. She spoke a lot about L-theanine. So I did introduce that, but I didn't notice too much of a difference. But what was a game changer for me and is a game changer for a lot of my clients, circling back to that adrenaline, GABA. GABA is big for me. Like I'll feel the impacts of GABA in 5 to 10 minutes. And that's if I'm completely honest, that's partially why I don't have sleep issues, because I knew I had to block that adrenaline before it peaked in order to get a good sleep. Amino acids are very important, and we, as you know, we look at them in different ways. And with my background being in personal training, there was always a big emphasis on BCAAs, which I never kind of got sucked into because I never liked all the artificials and the sucralose and all that. That was just like, I'm not playing around with this. I already have diverticulosis issues. Let's not go there. But I will take clean essential amino acids. But in regards to diet, and I don't like when people get too dogmatic over diet, because I really do believe human beings, we're omnivores. We should have a balanced plate. We're designed to eat everything. Meat is a big part of my diet. In the aspect of amino acids, I make sure that I'm getting a lot of red meat into my diet. I'm not eating hot dogs or burgers or anything. I'm eating grass-fed steak and
Mhm.
extra lean beef and the good stuff, lamb sometimes.
Sure.
So I'm getting a lot of amino acids in my diet. And especially when I came across research showing that protein first thing in the morning when thyroid is optimal is going to encourage better thyroid function. So then that became a staple in my mornings as well.
Absolutely.
Where we had mentioned when I was overweight, it was mostly toast and cheese for breakfast.
Exactly.
Now it's I'm getting that meat in no matter what.
That's great. That's awesome. Well, I appreciate your story. I think you have a lot of interesting little turns and detours and little challenges within each of those aspects, right? I mean, just getting the weight, and then you had the skin and the elasticity, and then the thyroid, and then the hormones and the stress, and it's great. I mean, I think any good practitioner has a little bit of a healing journey that they've gone on, and it allows them to be more empathetic. It allows them to have the confidence when they deal with patients to say, "Hey, I've been here. I know what you're going through. Trust me, I got this. Let's go."
Mhm.
And so I appreciate that. And we're going to have your link down below in the description, Chemaine'sModelHealth.com. I'll put the link there for you guys to reach out. Any other places you'd like to refer the listeners to, Instagram, social media stuff?
I have my YouTube channel where you have been a guest on my podcast
Yes.
as well. Um, I have my Instagram too. If you don't mind, Dr. J, I'd like to just add, like, I definitely do not claim to know everything. I have a lot of experience, but I don't know everything. And I think coming across a practitioner that is too dogmatic in what they're teaching is something that people need to be wary of. We're all very individual. It's not one size fits all, as cliche as it sounds. And listening to the person and their words is really, really important,
Yep.
because someone is generally, when they're speaking, they're going to tell us what's happening and what's wrong. Um, so I'm only adding that in now because there's so much now around, oh, do carnivore, do the primal bod, do this. And
Mhm.
people are very dogmatic about this stuff. And I don't think that's right. I think it's quite misleading.
Yeah, I mean, the analogy that I kind of, is I always think of analogies because I think in pictures and stories and metaphors, because patients get that. Being a good practitioner is like a handyman that has added tools to their tool bag. So when you got to hang drywall, you pull out the right tool for that. You're not just like, well, I got a hammer and I got a flathead screwdriver, so I'm going to make that tool work. It's like, no, no, no. I am result driven and I go grab the tool that in my tool bag that works because I want to get the right result. I'm not tool driven, meaning I have to use this hammer, even though the drywall job does not require a hammer. It's like I'm results driven. So I'm going to go pick the right tool for the job so I can get the patient the result.
Exactly. And
Hmm.
again, when you listen to someone speak, they're going to tell you what tool you need to use.
Hmm.
And I'm sure you agree, if we don't know the answer, we're going to try our best to find out what it is.
Yeah, I mean, there's a reason why some people can do well on a potential vegan diet, vegetarian with more carbs, and some people, most people not, right? It
Mm.
has to do a lot with metabolism and what kind of fats and proteins you're eating, and it's a whole bunch of things, right? But
Mhm.
that's why some people can get results on different diets. I think most people do better with less carbs because they've damaged their metabolism, but there's reasons why some may fit into that camp, right? So
Mhm.
it's good to know why, so then you can apply the right tool or adjust the macros in a way where they feel better, right?
Yeah,
I think it makes
absolutely.
sense.
Yeah.
Well, great.
Okay.
Thanks, Chemaine. Anything else you want to let the listeners know about where to find you? So I'm guessing all the socials will be at the website, right? So if they go there, they can click
Everything.
and
Yeah.
find you. Great.
Yeah.
Awesome. And then
Everything is
you do
there.
see patients worldwide too, right?
I do. I speak to, I have a waiting list, but I do see people, and I think people are attracted to the Irish accent, so that works in my favor.
And what's the average person coming in to see you for? Is it the chronic weight? Is it the hormonal challenges? What does that look like?
Right now, it's the hormones. It's
Mm,
perimenopause is everywhere right now, as you see it. Everyone from Bill Campbell to ourselves is talking about perimenopause. Andrew Huberman, it's just the hot topic right now. So that's people are coming to me because they're desperate. The doctors are not listening to them. And like, if we're completely honest, most people who have hormone issues, they generally have weight issues as well. So they do need to address that aspect too, because you unfortunately you can't be overweight and not expect some sort of hormonal issues. That's just how it is. As much as we're told it's not, it is.
yes. Hormones, again, if you have stress in your body, poor nutrition, poor sleep, any lifestyle or nutritional or chemical stressor has a reverberation on your hormones downstream because your hormones are either dealing with inflammation or they're helping your body rebuild and repair, right? It's either you're going in one of those two directions, right? So I
Yeah.
really appreciate that insight. Anything else?
Well, just back to that, like, and I'm not trying to pick on anyone, but if you have extra body weight, you're going to have more of that estrogen. You're going to be
Hmm.
spitting out more estrogen. You're going to
Hmm.
be spitting out more inflammatory cytokines. We know that heavy metals are stored in fat cells. Fat cells, when they do release heavy metals, they can attach to estrogen receptors, which will directly target metabolism and systemic inflammation. So again, like, these are my final words. If
Yep.
you have extra body weight, there's probably going to be some hormonal issues there, and that's just biology. It's
Yep.
nobody's fault. It's just how it is.
Yep. And you got to look deep at it so you can test it and then figure out if what you're doing is moving the needle. And then also, are you creating the results downstream? Right. So I like it.
Yeah.
Awesome, Chemaine. Wonderful to chat with you. We'll do a send off here after I end the stream. But anyone listening, feel free, comment down below. Love to see what you guys think about it and reach out to Chemaine if you need more support or just, get on her Instagram or her YouTube as well.